Hi there, welcome to Ask the Chiropractor, your source for ultimate health, healing, and chiropractic related information. I'm Dr. Adam Rodnick out of Commerce Township, Michigan, and I'll be your host today. We're here with our guest, Dr. Corey Baltazar. Welcome to the show.
Thank you for
He's
having
out
me.
of Northville, Michigan, and glad to have you here. I'd like to ask you a little bit about how you got into the profession and why you decided to become a chiropractor.
Well, it's kind of an interesting story. When I was probably around 10 to 12 years old, can't really recall exactly when, used to always loved, doing massage with, either getting massage done to myself or giving massage to whoever, was willing patient. And I used to crack either my mom's back or my little brother's back or my older brother's backs, and I just thought it was fascinating. And my mom told me, well, there's actually a profession out there, and there are doctors that do this for a living, because she always told me it felt better and it made her, it really increased, her function. So I decided that that was my calling. So here I am today.
It's funny how you got into it, but we want to make sure we don't want to encourage our studio audience or people at home to do the same thing you did when you were a kid, huh?
Yeah, I was very untrained, and I realize now that was dangerous.
Yeah, but it brought you to where you are today. So
yeah, exactly. So,
and one of the words you used there, something I'd like to explain to our audience. You said the word, crack the back.
yes.
And so I know that's a word that a lot of people will say. Chiropractors, they crack backs, crack necks. And so what is it? Could you tell our audience what the cracking really is and why it's not actually cracking?
The cracking is just a release of gases in the joint. The spine is made up of 4 joints per spinal segment. So what those joints do, it's just like a knuckle or any joint in the body. There's gases in those joints, mostly made up of nitrogen. And what happens is when movement is placed into these joints, they release that gas and make a popping noise. So it's not what chiropractors do is very specific. We're finding levels of vertebral subluxation, which is areas that the spine isn't moving. It's starting to affect the nerve supply. So what I did as a kid and what a chiropractor does is something completely different. I just went to areas that there's pain, but there's not always pain related to with a subluxation. Chronic subluxations typically aren't painful. There is long-standing inflammation there, so your body overrides that pain. So there's a very distinct difference between the two, but that popping or cracking is just gas releasing. So it's not something to be fearful of or afraid of. It feels, the adjustment should feel good unless there's a lot of inflammation.
And a lot of people do come in and they're afraid of that sound. They
yes.
see too many movies where someone sneaks up behind them and cracks their neck, and the person drops to the ground. They kill them. And so it's not really like that at all. And the sound itself, like you said, it's kind of like a can of soda. You open a can of soda, it's not the can that makes the sound, it's the depressurization of the liquid turning into the gas bubbles. And so a couple of ways that something could cause depressurization like that. A decrease in pressure is what we use during the chiropractic adjustment as the joint capsule opens up. An increase in temperature would really do the same thing.
Exactly.
Technically, if someone was cooked, they would have popping sounds.
Exactly.
Unfortunately, there hasn't been very much research on that one. So depressurization does the same thing, makes that sound happen. And you used the word subluxation a minute ago, and I want to explain to our audience a little bit about what that is and how that really is becoming a more popular word in society where, 50, 100 years ago, nobody knew what gingivitis was. Now everybody knows the word gingivitis. And so subluxation is becoming a more common word where it certainly should be.
Yes, subluxation is a term that we use as chiropractors. There's a medical subluxation, which is, the dislocation or a subluxation is a partial dislocation. Okay, as chiropractors, we look at it as, yes, the bone was partially dislocated, but not out of its actual joint socket. It's just a slight moving. Now it's an injury to that joint. The joint, it takes 12 to 16 weeks for any joint to fully heal. So during that time, we want to make sure that the joint is moving properly, and that new tissue, that new connective tissue, can layer into the joint properly, not as a scar tissue, which restricts the motion of those joints, okay, and creates a long-term chronic injury of those joints, which ultimately will lead to dysfunction of the nerves. So
And subluxations can happen in multiple planes, multiple ways. What it is, it's that minor misalignment. So, like we said, you think of something like a dislocation, you know, a ball and socket joint, pull it right out of the joint, that's dislocated. A step below that is a luxation, a step below that is subluxation. Sub-zero, a little below zero, subluxation is below a luxation. You know, and you can have even just millimeters here of misalignment can cause irritation. They say 10 millimeters of mercury, which is the weight of a dime, can shut down a nerve, the function, or the quality and the conductivity of nerve up to 40%. And people think of the term, another buzzword is pinched nerve, you know. And now it doesn't have to necessarily be a pinched nerve where a hard bone pinches on a soft nerve. We can just have slight irritation as well, right?
Exactly. From that inflammation, people think you know, a lot of medical doctors even say, you know what, that foramen or that hole that the nerve comes out of is so big, there's no way that there can be actually pinching of the nerve. Well, it's not so much that. There's a blood supply there too. There's an artery, there's a vein, there's other fat adipose tissue inside that foramen that protect and nurture the nerves. So if there's any slight misalignment there, it is going to put pressure, and along with the inflammation being there of the injury happening, which is creating the pain that tells us, hey, stay away from that, let it heal.
And that can cause just even a slight irritation. I use this analogy with our patients a lot is, if you were trying to look at our studio audience right now, and instead of, pinching you off, I just kind of went like this in front of your face. Yeah. Now I'm irritating you. Obviously, you're not going to be able to function or observe as well as you could without it. And so what we want to do is we want to find, locate, and remove these interferences or these subluxations as chiropractors so that the body functions at an optimal and functions at that 100% potential.
Exactly. So, there is a lot of different causes of subluxation. Three main ones we talk about in chiropractic school is, we say the 3 T's, traumas, toxins, and thoughts. So today we'll get into what the emotional, I call it the emotional subluxation, how it drives disease and sickness in the body, and how it actually affects the spine, which is quite fascinating, and something that I deal with on a daily basis. I see probably, I don't know, anywhere from, even if patients don't bring it up, I know it lies, emotional subluxation lies in their spines and in their health, and deteriorates their health more than they want to admit. And that's why, when I see patients getting off their antidepressants and things that just mask the symptom of the emotional subluxation, those are, that this stuff works.
And most people don't think or wouldn't think that thoughts could affect their physical health. But we'll explain something called the fight or flight response, or the sympathetic nervous system. And this is a portion of the nervous system that deals with fighting and running. So if right now a tiger is chasing after somebody, immediately blood's going to be pumped away from their digestive system and their reproductive system. It's going to be pumped towards their muscles. Their pupils will dilate. They will run a little faster. They'll jump a little higher. Their blood pressure will increase. Their heart rate will increase. Their respiration will increase. Their insulin levels will change. The entire physiology will change.
Exactly. This is a normal response of the body when it's in a state that it needs to be.
It can be life-saving.
It's a life-saving. It's a protective mechanism of the body. So we have these autonomic or automatic nervous systems that allow us to breathe, digest, so we can, be nutritionally fit to survive. I mean, it's the survival of the fittest out there, but we don't want to get stuck. I see too many people getting stuck into that fight or flight sympathetic state where they're in that constantly, which drives, adrenal stresses. Adrenals shut down the thyroid. So when the adrenals are firing, the thyroid's shutting down. It's so you stay in a balance.
Metabolism is off.
So your metabolism gets off. So if you're in this state constantly, and you don't deal with, depression is a good thing. People look at me and say, well, doc, I'm depressed. I said, well, it's not, that's just that's an emotional state, and it's your body's ability to deal with an emotional problem that you've been faced with. You shouldn't just brush it aside and take medications. And
we need those responses when something major happens in our life to compensate. Unfortunately, too many people have those type of responses because they spill a glass of milk, or
Exactly.
something simple happens that shouldn't put their body in higher blood pressure and respiration rate and change their insulin levels and dilate their pupils. So it's important to learn how this response happens and just really be in the know about what it is physiologically.
Exactly. So, when it's, I mean, I don't like to stereotype, but most of my female patients, they're in a fight or flight more than a male patient, and the reason that is because they're right brain driven in general. Right brain perceives that fight or flight response. Okay, so if you're in a right brain state of mind, you're not in the left brain, the logical. You're in a right brain state of mind. You're fearing. You're looking into the future. I got people that worry about the kids that they don't even have yet. It's like, worry about the present day. Yes, you need to think about the future and things like that, but not in a fearful state. Not worrying about, and that's kind of what our society does. Is everything's really driven through the news, and it's designed to make you sicker. If you're constantly in a state of fear and fight or flight, you're not going to be healthy. Okay, because it just, like I said, it drives the unnecessary things that we should only be. If you're in a car accident, you should get a rush of adrenaline in case there's a situation
if a
that
burglar breaks in your house, you need to have that response. You want to have
you
that.
don't want to be
function,
just
you're going to react a little quicker.
calm and, oh, okay, we have to put down your gun. And
your body shouldn't be thinking about digesting lunch from this morning. It should be thinking about saving your life immediately. So now, doctor, how does all this emotional response, how does it affect the spine? How can it affect and cause subluxation of the spine as well?
Okay, so we'll talk about just general subluxations. Every single motion is tied into certain areas of the spine. Okay, we know that, this is through Chinese medicine, they found this out. So anytime that certain emotions affect, certain levels will be affected, and then certain organs are also affected by emotion. Okay, so the emotional response is, for instance, an autistic patient comes in. He has he has had this chronic low cough for the past 2 years. So I asked the mom, I said, well, what happened 2 years ago? And she goes, well, he 2 years ago, me and his dad split. I said, well, he's feeling emotional grief because it affects the lungs. I said, so emotional grief, now I know that it affects the lungs, and some people that feel that emotional grief will come down with an infection. He's physically now has a cough because of an emotional problem. He can't tell his mom that he's feeling that grief. So she thought it was a good thing because the parents used to argue a lot, and that she thinks of it as a good thing. He's feeling it as grief, and now his lungs are starting to be affected. So we know that if a certain organ is affected, that it reflexes back to the spine. We have the viscerosomatic reflex, okay? So now it's starting to affect the spinal levels, okay? So that's how I tie it back to the spine, as we get that viscerosomatic reflex. Now a visceral response, which is an organ, is now causing a somatic or a bone to be misaligned and irritation.
Let's talk about, there's been a lot of research done showing how organ function has links back to the spine. Even decades ago, there was a study called the Windsor autopsies, and they dissected thousands and thousands of cadavers, and they looked into the etiology of death, the reasons why that person had died, and they traced back to look at the nerve function and the nerves and how they looked for, let's say, someone died of kidney disease. And they found that that person, their nerve connection had shriveled up, and they had much less function going from nerve innervation to the kidneys, or from lungs to the kidneys, if that's how they died. And so that research has come really a long way since then, but it shows us which nerves innervate and how important nerve quality to our visceral or organ systems really is.
Yes, it's vital to our function. When there's no nerve supply or decreased nerve supply, even in the slightest bit, it changes the physiology or function of that organ. Okay, so you need to make sure. I've had patients, I adjust them, and certain vertebral levels just keep coming up, and I'm like, why? And then I dive a little bit more deeper into the case, and I find out there's some underlying emotional stresses that person's dealing with. Boom, we get the emotional subluxation cleared, and that spinal level clears up.
And the same thing can exist with, so we talked about emotional, same thing can happen with physical changes all the time. You know, the guy who wears a hard hat on his head, 30 pounds there, and everybody clunks it down like this, well, he's having the same trauma, the same thing every day, causing the same segments to have the same aggravation, irritation, and subluxation on a regular basis. And so it doesn't have to necessarily, a lot of times people think of the only people that should see chiropractors are someone who's, you know, can't move their neck and it's like this, and they had a major trauma or a car accident, and of course that person should absolutely see a chiropractor, and the sooner the better. But even smaller things over time that are physical traumas can have huge effects on the spine, even things as simple as posture, right?
Yes, exactly. So, you know, posture is a big thing, but also how you're carrying, you know, those same, you know, if you're depressed, how do you hold your posture? You know, you go into a fight or flight. What does a cat do when it's in a state of fight or flight? When you scare it, scaredy cat, the hair sticks up. So that's the same thing. When you get scared, what does your hair do?
It
sticks right up, right? So adrenaline starts to rush. Their spine actually arches. They hunch like that. That's the same thing that happens to the human body. What do we do when we're, you know, stressed at your job and you're at work? We go into a state of fight or flight. We hunch. We put a flexion in the spine. Flexion of the spine is sympathetic. It automatically fires the sympathetic fight or flight response. Extension of the spine. So I teach my patients that are oversympathetic to go into extension. Lay off the side of their bed. Get on one of those, you know, one of those yoga balls, and just go into extension to calm down that nervous system.
While we flex that thoracic spine, if you hunch it too much, you know, you can even see as seniors, most of our studio audience knows, so sometimes when seniors start to age, sometimes they'll even get that little hunch. That's just from years and years of being in that stress response, or from having bad posture, but from being in that flexion of the thoracic spine. And what happens is when that's in the flexion of the thoracic spine, we can get up to 40% less total lung volume, total lung capacity in our lungs. And people at home can try this. So most to stick their head straight forward, take a deep breath in, and then sit up nice and straight and take a deep breath in. They'll very easily and clearly notice a difference. They're not getting as much oxygen through their system when it's pulled forward like that. It causes that cervical curve to straighten out as well, where we should normally have 3 healthy normal curves here. So emotion can have a huge effect on it. And so like we said also, let's talk a little bit more about some physical things posturally. One particular one that we see, especially now, is text messaging. They're saying now 1/3 of all teenagers now text message at least 100 times a day. And so, and how do they usually text message? Just like this, head down, hunched forward like this, phone down here, and if they are doing that all the time, of course that's going to cause the spine to start to go in the wrong position. And of course now what we're even seeing is more and more teenagers come into our offices with symptoms, physical symptoms, pains in the upper part of the back, lower part of the neck, even sometimes numbness and tingling down their arms, because if you irritate these nerves right here at the base of the neck, they go down the arms. We'll see sometimes numbness, tingling in the fingertips. And we're starting to see that more and more commonly, unfortunately, with teenagers, with children. I even see x-rays of teenagers that we take now that's starting to have mild arthritis or bone spurring or degeneration just because they've been putting so much excess pressure or excess trauma into those areas.
Exactly. I'm seeing more military necks or straight cervical spines than normal ones, which is, it's unfortunate because of the stretch that puts on the spinal cord and the tension and irritation puts on the actual nerve roots. So another thing is texting is an addiction. You know, people think of it, you know, that you can just be addicted to, drugs or alcohol, but you can also be addicted to your phone. You know, people check their phone 1,000 times a day and text, you know, hundreds of times a day. To this affects the same exact centers in the brain as the dopaminergic centers of what create dopamine. So we're tapping out our dopaminergic centers. Now we're going to see a bunch of kids that have Parkinson's as adults. You know, they're going to be getting resting tremors, and you know it works the same. It works the same pathways. So, you know, it's not good all the way around. People are addicted to technology.
So let's roll a video clip here. We have a video clip where we're featured on a news story on Channel 7 just about texting and how this text neck posture can really affect teenagers. So we'll go ahead and we'll roll that clip.
Well, cell phones are a pain in the neck, literally. It's a warning tonight for parents and kids who are constantly texting. All that texting, tweeting, or game playing may actually cause health problems.
Making my neck sore just thinking about it. Well, if you find yourself looking down all day long at your phone, you could be on the fast track to a condition called text neck. And Glenn is here now with more on that new ailment many young people are experiencing, and I guess maybe more than just the young folks. A lot of people are texting.
A lot of people are doing it, and here's the problem. I mean, we just saw her doing it. You're keeping your head like this, and you're keeping it like that for extended periods of time, and it could cause a lot of problems, even with young necks, causing them to grow older faster. The pain started after Madeline Hughes started using her phone regularly in 4th grade.
There's a lot of tension in my neck, and when there's tension in my neck, it causes really bad headaches. And
I want you to put your arms up to the side and do little circles with.
Now the West Bloomfield High School freshman has regular visits with Dr. Adam Rodnick at the Rodnick Chiropractic Life Center, who was the first to break the news to her and mom Amy that she has text neck.
For every inch the ears go forward in front of the shoulders, we're putting an extra 10 pounds of pressure on the cervical spine, on the musculature, on the neck, and the shoulders.
It's gotten a lot better, and I feel like the headaches aren't, around anymore. And
Dr. Rodnick says he's been treating young patients like Madeline for text neck more and more over the last 3 to 5 years, that handheld devices have become more popular.
So if you hold your hand up like this, Glenda, you'll see the skin in your hand is loose and relaxed. But if you straighten it out as far as you can, the skin is now pulling, it's now tight, it's now stretching. And that's what happens when we lose that cervical curve.
Dr. Rodnick says even a 3 to 4 inch drop of the head over extended period of time can cause the neck and spine to age prematurely.
We bring her here about at least once a month, and then when she starts to flare up, sometimes bi-weekly.
What did you think when he said text neck?
It wasn't surprising, actually, with the amount of time that she's on her phone.
Well, I think going to the chiropractor helps, and just knowing what text neck is, it's making me have a better understanding.
And believe it or not, it may be even making her more social.
Kind of helps me get off the phone a little bit more, knowing that what it's doing to my body. And
well, the solution really is simple, and it involves looking up. Do some neck and head exercises, try to keep those shoulders back. And you saw Dr. Rodnick with Madeline, and she was so sweet. She's doing her exercise.
And I think it's really great to get more public education, like we're talking about now on our show, on the news, about things that are affecting the spine. And text messaging really has become a big one. More and more people are doing it, more and more people are causing damage to their spine, more and more children are seeing more damage to their spine at younger ages. Another big one we see is backpacks. I see kids literally carrying 40 to 50% of their weight on their back. Punch forward like this, and it's not even cool for them to wear it like that anymore. They got to do one strap it and walk around like this, right? Which obviously is going to be, anyone that knows nothing about a spine can tell this is clearly going to be bad for their spine. Obviously this person is not going to be able to function at an optimum because these nerves are not going to get full signal and full innervation here.
Yeah, all that musculature pulls. It's not only creating an imbalance in the spine; it's going to start to affect the extremities too. That whole, the thoracic outlet that comes through there, all that musculature. The nerves going through that area are compromised. A big thing is, can that create a scoliosis? Yes. A straight neck can cause a scoliosis. But another big thing I want to talk about is, which we can get to in a second, is scoliosis and how the emotional subluxation can cause scoliosis, and what most medical professions out there, orthopedics, will say it's idiopathic, or there's no cause to your kid.
Let's explain that. Idiopathic is a word that the people in our audience may have heard for multiple conditions. You say you have an idiopathic condition, which is really a fancy word. It's a high medical word that really means we have no idea why this happened.
Exactly.
We really just don't know, and you have it.
Exactly. And a lot of chiropractic neurologists out there that do functional rehabilitation of the brain, because the brain is plastic. We can teach new things, and the brain will adapt and grow and make new synapses all the time. So we can change the plasticity of the brain, which basically means that we can mold it to the you can change your personality just by doing brain exercises. You know, you can be less sympathetic, fear, future. You can get into, you know, if you start firing your left brain by doing neurological exercises to strengthen up and start firing those neurons and those tracks. But what I'm seeing is, you know, a really good case is scoliosis happening, which scoliosis is, you know, the curves have gone out lateral.
When we look at it from the front.
So when we look at it, when we look at it from the front. So now we're getting curves that are lateral, and what happens is the most common is a right convex, which would be this type of the right side of the spine. Okay, is actually curved like this. Okay, and then it usually comes back in the lumbar spine back the other way. Okay, the severity depends on the what I call the brain imbalance. Okay, so why is it more common in females? Females are more right brain in nature. Okay, so what happens is if the right brain is firing at a higher frequency than the left brain, okay, we're talking about the cortex of the brain. If it fires over to the opposite paraspinal muscles, which are the muscles that control the movement of the spine and lie right next to the spine, if those are constantly firing, what it does is creates a spasm and an arch here, and then we get a compensation down here. Okay, so it's now created from a brain imbalance. Okay, more than just idiopathic or we don't know. Sometimes I am seeing, you know, the patient comes in and their neck's straight. So now what happens? That increased tension and pressure on the cord is creating. It has to go somewhere. Where's the tension going to go?
A lot of times we
it
see
goes out lateral.
the compensatory curve. Let's say someone does have one curve here. The body will have to curve back here, and the body does that naturally to compensate. So most of the time, scoliosis goes like an S, one side and the other side, because if they didn't have the compensatory, the head wouldn't be straight. So the body naturally does it to keep the eyes level.
Yes, we always want to keep the eyes on the horizon. That's just nature. You know, our body will do anything to adapt, and that's the amazing part about the human body is its adaptability. You know, but if there is emotional stresses, physical or chemical stresses on the body, our adaptability is going to be decreased. Okay, so then when we have to deal with stressful situations and your spine is like this and your nerve outputs, you know, decreased by 50%, what are you going to do mentally and emotionally when you are faced with those? I mean, there's going to be your ability to deal with stressful situations is decreased.
It's decreased, absolutely. Your response time, everything, the whole immune system, everything is decreased. And so especially people with scoliosis, the earlier we catch it, the earlier we take care of it, the better. And that's why we take care of it in children as well. So that's about all the time we have today. Thank you for joining us on Ask the Chiropractor. Thank you, Dr. Baldessar, for being with us today.
Thank you for having me.
I'm Dr. Adam Rodnick out of Commerce Township, and this has been Ask the Chiropractor. Remember that God gave you the gift of life. What we choose to do with that gift is our gift back to God. See you next time on Ask the Chiropractor.